Welcome back to the Yin Fang podcast. Today, Heather and I are joined by Dr. Karla Mehlenbacher, a board-certified chiropractic neurologist who specializes in brain and nervous system health. We discussed mineral rebalancing, the critical role of fascia, the differences between functional and traditional neurology. Dr. Mehlenbacher also shares insights on concussions, brain inflammation, dyslexia, tics, and even why strapping infants into seats too often can disrupt neurological mapping. This episode is full of powerful takeaways for anyone interested in healing and optimizing brain health. Let's dive in.
Okay, we're here with Dr. Karla Mehlenbacher today. We're super excited about this conversation. You have a zillion certifications, so I'm going to let you introduce. But essentially, you practice functional neurology, more or less,
yes,
among things. Let's just start off with kind of explain, you can talk about your certifications certainly, but how did you get into functional neurology? What was the I can't unsee this moment, or I lived through this thing and now I can't go back?
Yeah, it was definitely not linear like a lot of people in the chronic health space. I was pre-med biology major, and I got pretty sick pretty quick after the Gardasil vaccine. And I had nodules in my thyroid months after, was getting severe POTS symptoms and blacking out. And I was in the medical world, right? So I was listening to what they were saying, and they were like, hey, they took out half my thyroid, took out my tonsils, and those things helped. And I was a senior in at university in undergrad, and just really got this intuitive, started to search for the alternatives of I'm curious about this. This just doesn't, I'm not getting a clear answer on why is my thyroid going to this storm all of a sudden at 19. And so it was truly just I wasn't getting answers. And then I had a family friend that was a chiropractor that was just hey, have you looked into chronic infections, or you maybe had some deeper immune stuff going on? And I was just why is he the only one making sense?
Mm-hmm.
Yeah. And it literally shifted my career path. I switched to chiropractic school because of that. And I didn't really know about chiropractors at the time. I just thought they were more musculoskeletal based, hand based. And I really was I just kind of I wasn't resonating with the surgery pharmaceutical aspect, mostly because if I'm not going to do it myself personally, why would I ever go down that route for telling someone else to do it? So I went to chiropractic school really just kind of out of the timing and the trust of I was going to go to med school, but now I'm totally pivoting. And when I got there, I was well, I don't want to just do back pain, and it's almost a belief level philosophical, which is beautiful, that the power that made the body heals the body. I love the chiropractic principles and the beliefs, but it was still I don't want to just adjust people. And that's when I found the functional neurology. And so it's, amongst the chiropractors, as you know, there's varying levels of how far they go in deep into the research. Mm-hmm. And I was just really attracted to the ones that went deep into the functional world. In Dallas, where I was going to school, I happened to be right next to one of the major brain institutes with Dr. Carrick. And that's when I got into the brain injury world and the vestibular rehab. I also started working with brain balance centers, if you're familiar. Mm-hmm. They are a childhood neurodevelopmental center that really focuses on motor sensory only and nutrition. Mm-hmm. And I was so blown away by how massive these kids' improvements was just from doing body work. Mm-hmm. And not talking about, medications or their behavior, just looking at their body and saying, what is their body doing? And do they have coordination? And how much that was actually affecting their academics. And then I just got really obsessed with it. And I got my fellowship in childhood neurodevelopmental disorders, and then my fellowship in vestibular rehab and traumatic brain injury. Wow. So I did all this at the same time I was in chiropractic school. So I was doing I was in school, and then on the weekends I was doing postdoctorate. So by the time I graduated, I was board certified in chiropractic neurology. And then I started training with Dr. Carrick, which is we started working with the Texas veterans coming back from Iraq at the time, and learned so much. And yeah, that's eventually I, got to the point where I was on my own practice, and now I mostly focus with people that kind of have more what I went through. So a lot of dysautonomia and POTS, chronic immune.
What's dysautonomia?
Dysautonomia is the autonomic nervous system when people talk about fight or flight, rest, digest, but really it's a where are you pushing blood, and how big are your pipes, are they contracted or, and so that was my biggest thing, was positional orthostatic tachycardia, POTS, which is where when you move positions or get up too quick, you pass out or can black out or get lightheaded. So that's what my biggest issue was, and that's now what I feel like I attract the most. But I also still see tons of kids. I see a lot of concussion, a lot of people that know they have more of a neurological based trigger, and it's not fully addressed with just diet and lifestyle.
Have you always been like a super curious person, or like it seems like listening to you talk about your educational background, kind of like you're interested in something and then something else piques interest and then even more, and you're like willing to just jump in and keep learning. Is that a trait you always had as like a
always
childhood?
Yeah, I truly have like always been just fascinated with figuring this whole thing out, of like, what are we doing, what's the point of this, like what's, and I guess I never was driven materialistically as far as financially in that way, where I was like, I need to have this certification and make this money. It was truly out of like passion of learning. I love the school experience, even though you have to pay for it so much to do it. But yeah, I was just fascinated, and I just kept wanting to do more. And even like you brought up the concussion thing, I studied deeply into brain injury, but I never imagined myself working with that population. It's not something I personally experienced. It's not something I even have direct family relation experience with. But I very much understand it and support those people, because there's not much out there. But I still am like, oh, but I'm curious in this now. I'm like a squirrel, where I'm like, yeah. And I'm even now more so into even broader perspectives of like just connecting and going back to source. And
Okay, so I'm like totally stealing. I'm jumping right into like some questions that I'm really interested in regarding when I listen to you about the dysautonomia and like, people that orthostatic hypotension type stand up faint or whatever it might be. Is that something you help people with, that like maybe struggle with, like they pass out or like, and personally, that was something I dealt with as a kid, like from a young age, like whenever like a big stressful event would happen. I can remember the first time I ever like passed out was like I got in a fight at school, and my mom was like called into like the principal's office, and it was like she like walked in, and it was gonna be like I was gonna get in big trouble, and it was like I fainted right as the big conversation was about to happen.
Really?
But like, and then in dentistry, when I started watching like my first week in dental school and shadowing like surgeons leading into dental school, I would get like in my head, everything would be fine. I'd get in my head and I'd pass out. And it like, I was so worried, because I was like, how am I going to be a provider if I'm fainting all the time? And like, fortunately, as soon as I was able to like hold the instruments, like it just went away. Like it stopped for me as soon as I was able to participate in the care. Like watching other people do surgery on other people did something in my brain. But like, long way to get to my question, like, is that something like in your, like, that is teachable, trainable, and
totally, yes, 1,000%. And it goes back to like the blood flow factor. I know fight or flight, rest, digest has really kind of take the psychosomatic world has taken that as like it's all in our mind, it's emotional, but it's really like, am I getting blood to the area? And when you are in those moments of like the pipes are tight, you're not getting blood to the head, and you're also not getting it to your gut, right? So it's all, this is where the leaky gut and the you get constipation or you get these gut issues. It's literally like it's the nervous system is what controls the vascular system. The nervous system controls the immune system. So it's like, how much are we letting in or out? And then why is it at that edge where it takes that little bit and you're like, don't have blood?
And like, first of all, like Heather, if she draws blood, if she's not laying horizontal, she'll like pass out. Like, are there like tricks that, like, is it not this easy? I don't know. Like, but are there like, maybe like is there something you could suggest to somebody that struggles with like drawing blood and they're fainting? Like, are there like, I don't know.
There's different, it is complicated, unfortunately. Some people it's more of a visual trigger. Some people it's more of like they start holding their breath and they're not actually inhaling. For some people it's like they already are at that kind of edge in their daily life, and so it just takes that little bit to like lose blood flow. So it is so many, like some people live from childhood, they've kind of had a similar pattern. Some people can truly have one instance that's so intense. So there's so many variables. And also, this is where I get into like, is it structural? Are you actually just not getting blood flow from a structural blockage? That's a very classic chiropractic thought, right? Mm-hmm. Is it actually like it's a perfusion issue? Then it's like, what's your cellular vitality doing? Are your cells breathing? Mm-hmm. Is this truly like a belief in repetitive thought patterns? So there's so many layers to this, right? Yeah. So there's like, and for everyone it's a little different.
Mm-hmm. Yeah. It also seems like some of that can be, if you're just talking about blood moving, it can be like a movement issue, or like where it's like I know for me, a lot of most issues that I have, it's like if I like move through it physically, a lot of times I can just like get in or out of something, which is like interesting. I think when you think about it as a blood movement issue, that kind of makes sense to me.
It all goes back to movement. And to answer your question on like quick things you can do, I mean, the big picture is get blood to your head. So first thing is put your head below your heart. Mm-hmm. And that's like such a general thing, or like lay on the ground and put your legs up, grab an ice pack, put it on your face. But then it's like, okay, why are you at this tipping point? Mm-hmm. So in the moment, things are different than like, why am I actually dealing with this as a human?
Yeah, and it's so frustrating if you're that person that deals with that challenge, because like everything's fine. Mm-hmm. Like I'm not nervous. Like, why is this happening? But then it's this repetitive thought thing. I think when you said that is what I thought for myself.
That's also really interesting, because I just took our middle son to a myofascial appointment, and he was because he's doing an expander, and so she was adjusting kind of his cranium and neck, and something started bothering him, and he was like, he wanted her to stop, and so I can't remember exactly what he said, but basically she was like, get up off the table, let's take a break. She had him like jog in place, like as fast as he could for 30 seconds to just kind of reset everything. And then she was like, do you still feel whatever it was? And he was like, nope, it's gone. And just like, and then he was like ready to go. And it wasn't like severe pain or anything, but again, like going back, like it's like moving. Yeah. It makes sense that you're just like, it does reset kind of the nervous system, I guess. And just like blood flow to whatever is being bothered, I guess. I thought that was like such a good trick. And I was like, oh, I should do that in so many areas of my life when I just feel stuck, like just jog in place like that. I was like, it just totally reset him, which is like kind of cool to see.
Well, babies come out in the sympathetic dominant state, and movement is what puts the inhibition on, right? So we move when the stronger muscle control we get, the stronger our frontal lobes get. The frontal lobes are like, hey, we're good. So that's why when we move, we're like, and they shake it out. It's like you're literally just turning on the inhibitors of like calm down the sympathetic.
Yeah.
And a lot of people's maps are off. Given back to the movement thing, this is where the neurodiversity and childhood developmental stuff goes, because if their nervous system's already automatically pulling blood in a certain behavior every time from reflexive patterns, their blood and electricity will go to one dominant system versus maybe a more efficient use of energy. So how do we correct that? We literally have to go through the maps of like, this is how we feel gravity. This is how we hold gross motor. This is how we do fine motor, complex thought. And we often jump to the top with the complex, especially the younger kids. And it's like, wait, this isn't a behavior thing, right? This is a mapping thing. It's where are we pushing blood and energy. And there's dominant states that the body will go into because of the primitive survival stuff. We have to actively work on the inhibitor ones.
This episode is brought to you by Yin Fang toothpaste. Yin Fang toothpaste is a 4-ingredient toothpaste with coconut oil, baking soda, cacao butter, and nanohydroxyapatite. It's non-toxic. There are no preservatives. It has low abrasivity, which preserves your teeth. It supports your oral and gut microbiome, and it's remineralizing. We ditched the tubes to help the planet, and instead, Yin Fang comes in a sustainable zero-waste packaging and delivery system. Get yours at yinandfang.com. Okay, so I want to go back to... I want to go back to, you were talking about kind of what sent you down this path. Yeah. What were some of the things that you did? I know you said you met with a chiropractor, but like, what were some of the actual things that kind of helped you move through your thyroid issue and what was going on?
Yeah, like I said, it wasn't linear. I actually had the thyroid surgery and the tonsillectomy, and I did feel better. And I moved to Europe. I was very rebellious against pharmaceutical, and I was like, I'm going to be in Europe. I'm not going to have health insurance. I was like, no, we're not, whatever I need to do to not be on prescriptions. And they told me like, you're going to need to be on prescriptions the rest of your life. And honestly, going to Europe, I got better. And then that's another layer where you're like, why is that?
Yeah, that's so.
So a year later, I came back and went to grad school. I went to chiropractic school, and everything came back immediately and worse, because the stress, right?
Yeah.
And then that's when I went down the infection rabbit hole where they're like, hey, you have Lyme, you have parasites, you have Epstein-Barr. And I went down that rabbit hole where I did the antibiotic thing even. I went to a Lyme literate medical doctor and Rife machines and colonics and all the diets, right? And some things would shift, like my breaking out in hives would stop, but not necessarily the blacking out. It's like little, like you can master one symptom, but then you don't still fully feel. And then it wasn't until I really started getting into neurology and the mindset, I got very much into body work and things like Joe Dispenza and mindfulness. And I tell people this because it's true. I literally watched a documentary about What the Bleep Do We Know? Do you remember that one? It's from like 2009, 2010. It's just all about how our beliefs create our reality. And I was literally, after watching that, I was like, I'm not identifying with this anymore. Like, I'm healthy. And I stopped all the supplements. I still would do the gluten-free thing because it was just an obvious, I get flared up. But there was never like a hard, I'm strict with this thing. I just was like, I'm not gripping onto this anymore. And that's when I first started getting better. And truly, on a physical level, the things that helped me the most was the nervous system stuff. Was when people did neurofascial release on my neck and face, it was like, oh my gosh, I have blood flow. And this coat hanger thing that we all deal with is it's a structural thing, but you're wondering why you're getting lightheaded when we literally are not getting blood up there. The tight shoulder, forward head posture. It's that coat hanger syndrome is an actual medical diagnosis because it's and the text neck is actually now a medical diagnosis. But it's just it was things. It honestly was the low hanging fruit stuff. But truly, all those things helped. Like the parasite cleanses helped at certain points to get me through this next level. And I would say the most recent, even in the last 3 years, is when I've actually felt fully vital again. And that's been since mineral balancing. So a mineral balancing is where you do hair tissue mineral analysis. And at first I blew it off like a lot of people do because it's kind of very much that's not really scientifically supported. And we don't, it's like testing stool. It's very controversial on how valid it is, right? Because you're taking a sample. But I started studying under this guy that I just got obsessed again. I was like, why is no one talking about minerals? This is foundational to cellular vitality. This is foundational to your electrical potential of your nervous system. Yeah. And once I started minerals, I literally was like, oh, because I think all those other things got me to the 80%, 90% where I'm like, I can live like this. I'm good. And then I had, you have to be careful. But this got me to a place where I'm like, I'm literally not scared anymore. I feel I'm almost like, guys, everyone needs to do this.
Right. When you find something that helps you want to share it. Exactly. That's how you know it's good, is when you immediately want to share it with other people. So when your vast improvement in symptoms when you were over in Europe, I'm curious, and then looking back on it, do you think that's largely environmental or emotional, stressful, or?
I thought about that a lot. The timing of me going back to school, grad school is the most stressful time for anyone that goes to grad. So that alone, without the America versus Europe thing, could have done it. But I do think there was an environmental thing for sure. Even I remember coming back and my dad being like, "You look different."
Yeah, I've shared this story, I think, on one of these other episodes where I have my dentistry, I'm removing people with failing teeth everywhere, their whole mouths are failing. And a guy who I believe him, he's like, I had good teeth, and I went and did a stint of. He was an engineer, so he went over to India for 10 years as a chemical engineer. And he was he's like, I swear, it's the pollution and the air and the environment. And it's and I came back, I had severe periodontal disease. I lose my teeth now. And he swears that, and he went from really bad back here, where in Texas it's probably not great either, right? But I believe these things when I hear them.
Mm-hmm. Yeah, I do too. And I was at the 8. I was young. I was like 22, so it was also like discovering life, things. But I think there's also that played a role in my happiness and overall. Yeah, so there's so many factors, but I definitely do think there's a thing with that. And I even just from patient experience, when they tell me they go to Europe and how much better they felt, and they're like, and this goes back to the nervous system stuff of someone could have all this stuff and then they're like, I went on vacation and ate whatever I wanted and I was doing great. And I'm like, well, why do you think that is?
Yeah.
It's you're with community, you feel safe. Like there's so many factors that play into this. It's not just the food, it's not just the environment. It is, but it's like all these factors play into how much our nervous system is going to move.
Yeah, I still think like the bucket analogy is still so valid, where it's like at some point it's going to overflow. It's like you don't know which thing is going to do it, but
and it's the chicken or the egg thing too. Like that's my whole thing with the nervous system. I'm like, what controls the immune system? What controls the cardiovascular system? It's the nervous system, and that's why it's like, which one do we start with? And I think it's very misunderstood, especially now that the therapy world has kind of taken it and been like, this is nervous system. I'm like, no, the nervous system is your body, it's physical, it's movement. There's an emotional component for sure, but that's just a tiny part of the conversation,
So one of the things I think that's gotten really popular to talk about is like the gut brain connection. So when you think about that in relation to like neurology and the nervous system, how do you look at it? Like, what do you think is kind of controlling what, or do you look at that as kind of a chicken or an egg too? And I guess this, as I'm saying this out loud, like the brain is not like, it's the nervous system is kind of the outer shell of all of it. Or how would you kind of explain those two things?
Well, it's still from the lens of the nervous system is always movement, and it's just movement of the intestines. So when I think about the gut brain connection, it's a two-way highway. And there's people that will argue like, well, 80% goes up to the brain and 20% goes down. And so there's truth to that, but then it's like, yes, it is both, but also you can do things from the bottom up to also help the gut without just being diet, right? I can do physical manipulation. I can do, and also like we were talking about, am I wasting energy in certain areas that is pulling from my gut? But when you go back to babies, it really is, what do we do with a baby initially? We're giving them their proper fuel and microbiome, and then we're providing movement. So it's both. It's like, which one? I don't know. It is both because they're always going together at the same time. But the separation I have is like, which one of those things makes us different from plants is the movement part. Because otherwise all that other stuff is really similar to everything that's alive in the world. And that's all energetic, and there's a lot of things and factors, but like the movement part is the difference with the nervous system. And these kids that I described, like when they're doing brain-based mapping and it helps their gut, right? Like how is that connected? Well, they didn't make a diet change, they didn't, so it's an interesting conversation. And this whole 80-20 thing isn't even fully true, but there is all the studies they've done on the like top down placebo, is it my mind controlling it, is only like 20 to 30%. Everything else is from the body up. And I would say, my biased perspective, I think the nervous system wins as far as leaky gut and those things go, because I believe your belief and fear of what you're consuming is literally creating that as well. I'm very much not one of those like be scared of your environment person, but I also recognize that we have a lot of poisons, so I still believe that I'm strong enough to handle it, and I'm gonna still consciously avoid those things. I don't know if that answers it.
Definitely. I think as I've evolved through my own journey and watching people heal, watching like my own healing stuff, I totally resonate with what you're saying, that ultimately to me at this point it's about belief and like connection to spirituality, and I think that's like a huge overarching part of it. And at the same time, like your body does need whole foods to like produce everything inside in a healthy way, so like you do, like it's hard, like you need both, And I think it's impossible to tell like what is doing the most work. But ultimately, I do think that I agree with you. I think it's so much of it is movement and belief, like at the very basic level of health. Yeah.
Even those blue zone shows, where they try and find the thing and like prove that it's some sort of nutrition or diet, and they can't anytime. It's all gets back to community and love and connection. And movement.
Yeah. And I think if I look back in a similar way, if I look back to kind of like the crux points of when I went through these like intense points of chronic illness, because it was in my mind, it's like it was constant. But the truth is I had like some really like critical points, that kind of just like pushed me over the edge of like, I don't want to deal with this. Like I'm going to find a solution. And when I think about those moments, they were really high stress. Like that is the unifying factor of all of them, right? It's like, yeah, maybe I was dealing with some little things, but then this thing happened, and then it was like my symptoms were just out of control, So that's like such a it's important to recognize, because I think we can like look for all these solutions in a million different places, and sometimes it's like what's around you, what content are you consuming. It's more challenging for children to like understand what's actually stressing them, I think, in some situations, but it really is like what you're taking in and believing, and how you're interpreting it. I guess everybody's different. Everybody's filter for that is different. Like what you interpret as stress, right?
Yeah.
And it's a disconnect from the body, right? You're like, what are you saying? What do you want? And that's like, why are we not getting a clear answer? There's a disconnect from the tuning in, and we're not taught this. Like to teach a kid to, okay, let's sit down and listen to what your body's saying. Like it's not the first thing we do, right? But it's actually what we should be teaching them in school,
Yeah, absolutely.
Yes. Like what does your body need right now?
Yeah.
It's kind of like beaten out of them a little bit. I think because I think they have it as little kids, and then it's like
asking permission to pee, like all the things. I mean, all this is like that's such a natural instinct that you're having to go out an external source outside of you to give you permission to do. It's the whole thing.
And we see it when certain kids would be like, I don't want to disrupt the class, so I'll just suffer through this and hold it. About movement in particular, like, can I like zoom into that a little bit? Because I think we're talking about like physical movement, but then you also talked about like intestinal movement, like in the kind of same vein. So there's almost like there's multiple types of movement we're discussing, right? Like one would be like physical movement, and then the other, you mentioned intestinal movement, and I like immediately thought of the various like drugs that people are taking right now that maybe are impacting intestinal motility, like GLP-1s, and could that be like stress inducing if kind of, I don't know if there's any connection there or any.
There definitely is. I guess it depends on what's your goal and how deep into your symptoms are you to get out of that. But the mobility part is literally wherever I put awareness is where blood is flowing. So even just thinking about my hand right now, blood just moved to my hand. So same thing when I'm in a relaxed state, it's now blood is able to go to those reproduction, and so it's still a moving blood and energy to the area, even if you're not physically moving, because I'm focusing on it. And thoughts are actually micro movements. So they're all forms of like, where am I pushing energy?
Got it. Neat. Can we like also talk about someone in the provider space, like in dentistry, people come in and they have like complex pain in their face, and it's like, is it TMJ? Is it whatever? Like, you can almost go through these assessments where you're like, okay, this is not TMJ pain. This is not coming from your teeth. This is something I don't know. And like the classic referral is like, you probably need to go find a neurologist somewhere. So it's like the ultimate like turf referral. It's like, I don't know what to do, and these people have been bounced from like provider to provider to provider. And then I imagine you're in the functional neurology world, so it's like even a further like, are a lot of your patients like dealing with super complex stuff, and they've seen many different doctors with no answers?
And in that, can you explain a little bit of like the difference between a traditional neurology approach and functional?
Yeah.
Like why they would seek you out versus?
Yeah, I would say the difference is medical neurology is looking for severe diagnoses and imaging and surgery perspective of like, is there something life-threatening going on, which is so important and valid. And that's why the whole thing started, right?
Mm-hmm.
But functional, then once they say, okay, this is the diagnosis, they're going to refer out after that and say, this is how you manage it, either with medication or maybe some physical therapy referral. But that's kind of where they stop, right? If I can't write a prescription or do a surgery or refer out, then that's the where the line stops. But I look at it more of like, I always say I'm like a nervous system mechanic or engineer, because you really know how to connect all these things. And to go into the face jaw thing, there's so much about that that's nervous system based, all connected to our social engagement system, because the first level of the autonomic nervous system is the ventral vagal, which is all because we socially regulate and we hold our face a certain way because we're getting feedback of like, are you a safe person? Are you picking up what I'm saying? Because we're tribal, it's so connected to our sense of safety. So just the head up is so big on how safe do I feel. And so a lot of people reflexively hold their jaw, or even like the eye twitch, and all the trigeminal is connected to the autonomic. So when people talk about like the gut brain, I'm like, it's also the face. It's just as much as the gut. So doing those deep face massages is just as powerful as doing a deep abdominal massage. And I often do myofascial release on people's face and jaw because of this. Especially these immune people, their fascia can get so inflamed, and it's actually like the fascia is tightening down on the nerve. So is it that you're anxious and crazy, or is it that you just literally are getting irritation to the areas that socially regulate?
Yeah.
So it's both. Some people are like, I'm not an anxious person, but this is, and it's like, yeah, it's structural. You know?
That's interesting because like I have learned to use myofascial work as kind of the nervous system reset. Like that's when I feel stuck in either physically or emotionally, whatever. Like that is, so is that, are you doing fascia work on people? Because I mean, that is where I just know from personal experience too, like you hold a ton of your like emotional regulation in your fascia, and like it just can get jammed up, I guess.
Yeah, I'm gonna say majority of what I actually do with people, because people ask like, what do you actually do? I do a lot of neurofascial release in the jaw and face and ears, and also in the gut and abdomen. And then I also give people really like their kind of maps of like, this is what you're like. Maybe you have a dominance in a cerebellum or a hemisphere dominance, or maybe you have some reflexes that aren't integrated, and then you kind of know, okay, I need to work on this and go integrate that into your life, into your workout, into your day, so that you're, because you can't just come into someone, you have to do this in your daily life to make these changes. And then of course I have the tools like stim and laser. I have a biofeedback machine that people are doing reflexive type of movements and eye exercises. But a big part that people love to come back just because they love it is the neurofascial release part, because it's so, no one really does it, and because it's not like a massage, it's not comfortable. You're really like digging the nerve out, but it's when you have these immune things that cause inflammation, the fascia, I also believe the fascia is very misunderstood. It should be considered its own organ, because it goes from a liquid state to a solid state constantly based off of our inflammation, and it's wrapping around those nerves and muscles. And then we're blaming like, oh, I need to work out. It's like, that's actually an immune reaction. So there's so many layers to this.
So I'm so curious, trigeminal neuralgia, because I actually know several people that have been diagnosed with that. And is that something that you have, like, can give people relief from? Have you seen people walk away fine?
Yeah, for sure. I've seen people with, after one session. It depends on what's going on. And how some people can have more internal brainstem type stuff, which is a little more difficult. People with concussions or brain injuries, but a lot of times the classic trigeminal neuralgia is more superficial.
Oh my gosh, I have 2 people I'm going to refer to you, because this is like, I'm like, I know that it's something nervous system related. I've understood that, but I had never thought about that. That it's probably fascia, and exactly what you're talking about. That's really cool. I mean, people with trigeminal neuralgia it's horrible. It's horrible.
This is why I like, as much as chiropractors are kind of put into this bucket of like just adjusting the back, but they are literally looking at the neuroanatomy. Like, is the nerve getting to the end point, right? And that's such a simple thing, but so many people don't actually do it. Like, did you actually touch the body and feel the nerve and feel if it's moving? And
Yeah.
I do want to, maybe this is too much, but going back to this like immune system versus nervous system part from a neurodevelopmental perspective, there are certain parts of the left brain versus the right brain that can produce. Are you guys familiar with like Th1, Th2, like immune dominant people? Basically,
No.
like if you have a severe dominance like these autistic kids in one side of your brain where you're like super good skilled at this but then not, you can actually like cause hyper reactivity to immune response. So these kids often have allergies, they often have asthma, right? And the fascinating part that I witnessed is when we balance that out, it actually balances it can actually change their asthma, it can change their immune reaction, because it's the brain that sends the signal for how much do I need to release. And the right brain is more immunosuppressive, meaning like it's someone that actually doesn't get sick often, or if they do, it's like a really dragged out healing process where it's like lingering. And then there's the other team that's like hyperreactive allergies, and you can literally see it in their body physically because they have these dominances in their posturing and the way that they're moving their body, way more obvious in kids while they're developing. But a lot of people can be walking around wondering why they're so sensitive to the world, and it's actually because their nervous system is imbalanced in that way. And not the bad thing. We all have like our uniqueness, but when it comes to where it's actually causing an imbalance, then we can do something about it using the body up.
Yeah. So is that something that you can affect with regular chiropractic work also, or is this like specific to your specialty, what you're talking about right there with like kids and I don't know, maybe like autistic kids or like hypersensitive kids?
Chiropractic work would do generalization, like any input from the spine up is going to feed forward to those, but they're not, depending on the chiropractor, they're not typically biasing a certain pathway. They're kind of doing like, oh, this is off, let's adjust it. Whereas I will also tell you like, this is what you need to work on at home. This is what you need to focus on. These are the joints to think about when you're working out, to get way more specific. And you can even feel it. Like when I do these tests on people, they see it and they're like, oh wow, I need to work on that.
Yeah.
So it's not, and especially in kids, like you can tell these kids they're not coordinated.
Yeah.
They bump into stuff, they trip all the time, and it's like, okay, well, let's start with the maps. And then the maps control the reaction.
So do you work, sorry to interrupt, do you work with autistic kids quite a bit?
Yeah, I work with all the range of neurodiversity, and even from tics and seizures, movement disorder, even kids with migraines and things. Yeah.
And do you see from your perspective, like the work that you do, because we also have talked to like Jana Rosso from like the gut side of things, like the nutrition side of things. So like, do you see, I don't know, like neuro improvement and like, I don't know, social skill improvement, stuff like that from some of the balancing that you're doing in the brain? Yeah. And this is always like, which one do I start with kind of thing. I think the real answer to that is like, when they already are in a situation, do both. Like there's a reality to like, now the infection's there, now the antibodies are there. We're not going to just blow that off and focus on the nervous system. And that's why I work with Jana, because there are a lot of these kids that need the intervention in the moment to get them back to their immune system back down to not releasing antibodies in this cascade of issue. But also know like, why were they susceptible in the first place? Why did they reach that point of sensitivity? So always doing both. But I say to prevent, this is where I think we are massively doing a disservice to these kids with lack of movement as infants. The first year of life is one of the biggest setups for their entire brain, and they're being put in containers and strapped, and they're actually promoting lack of movement in the way we talk about it. And even up until 4, right, when they start getting their own a lot of strength, but they've already missed such a window. What is limiting their movement, would you say?
Propping them up in these containers, these bouncers, these straps, all of that is detrimental to the nervous system.
Like laying them on the floor.
Letting them figure out gravity on their own.
Yeah.
Because they're mapping out their environment. If they don't ever get to map it out, then their maps are always off, right? It's like when you go to a new place and you want to find the coffee shop, you map it out. And if you don't remember how you got there, every time you're going to be, where am I going? You're wasting energy. It's very wasteful. And then we call it a behavior issue, and it's like, well, they're just figuring out their maps. They don't have it laid out to where they can just do the thing they need to do.
I imagine most parents think, I'm putting this kid in a bouncer, I'm helping strengthen the legs so they'll start walking, but like it's just not the case, huh?
Limiting their pelvic floor, and I get it. Like I truly get it. It's a babysitter. It's like, how do I do my job? How do I do the dishes right now? Especially if you're doing it on your own. Like I truly get it. But also, like, we did this before the 80s. Like someone. Like, but I would say that's my biggest like preventative thing that I see currently, besides the environmental toxins, which is the whole thing. But the lack of movement in infancy is so huge.
Interesting.
Yeah.
Are you for or against like baby wearing?
Oh, so for.
Okay.
Yeah.
Not in terms of that. You're just talking about the like seats and contraptions that we kind of like plop them in. Yeah.
If they are contained and can't move on their own. Yeah.
So when you buckle them into something, red flag.
Interesting.
Not a red flag. I mean, anything, you can do it temporarily, but like how much of their day is done that? Are you just doing like that 30 minutes of floor time and that's it? Like it really should be the opposite.
Got it.
Yeah.
Yeah, that's so interesting.
And also there's so much you can do with the baby literally right off the first week of life, where you can stimulate their vestibular system, you can activate their ocular system, and you're mapping it out. And if you do it that young, you're setting up the whole stage of their life to be that much more effective. And those kids are the ones that are just like popping out the complex thought way earlier on.
Interesting.
Okay, so tangent here, but like I think related with kids, like we have 3 and one seems to love football, and he's 10. This huge conversation I've had with so many other dads, like, are we going to let him play football? When is too young? Or, when is there an age appropriate? And like, I imagine you have a lot of experience. You said you got a lot of experience in the concussion world. Can you give us your like insight on like your opinion on like youth football? Are there, like, I've read in some studies, like part of concussion reduction, like we talked about, was wearing a mouth guard as like a shock absorber. But the other thing they mentioned was doing neuromuscular exercises before a game. I don't know, like to me, I'm like, I don't know what that means. I don't know if that like means something to you. So kind of a 2-part question, like, what do you think about youth football and
soccer?
Yeah.
That's a good one too.
Yeah, it's tough, I know, because I know my nephew's obsessed with football, and I'm like, please no.
Yeah.
Even in FIFA, I'm sure you heard that they made it illegal now for at the age of 10 and under to head the ball because these statistics are so bad. I mean, that one study they did on the NFL brains, they did actual brain dissections on 100 deceased NFL players, and 99% of them had chronic encephalopathy, so some traumatic concussion. So those are like staggering statistics, right? It's not like, oh, you might not get it. It's like, you will. And so that back to the like, what do I do to prevent it? There's not much you can do. The reality is we were not designed for impact as humans. We have a skull that's encased with liquid and a tissue that's the consistency of tofu. Other animals that were meant to, like rams, they have a muscle wrapping around their skull in between the brain so that they can do that, right? We were not designed for that. Even our necks, especially women, have very small shock absorbency in our neck, which is why women are way more likely to get a concussion with an injury than a man, because you at least have that shock a little bit more than we do. So yeah, it makes sense that the mouth guard works because you're creating more shock, but I still say like, and true diagnosis of a concussion only takes 1.5 degrees per second of movement, which is not much. So someone, if they have an inflamed, and this also goes back to what's the state of the brain at the time of impact. Is it an inflamed brain? So the 2 kids playing the same game, one just had McDonald's, one had a nice, healthy, organic, calm meal. They have the same injury. This one's going to react way more than this one. So that to answer your question, like, yeah, there's a lot you can do to prep to limit that cascade of inflammatory reaction once the injury has happened. Because once the injury happens, the immune system's what's like, okay, let's clean this up. And that's often when the lingering concussion happens, is like the injury happened, but my immune system didn't have what it took. So it drags it out, which is why typically kids can hit their head and pop back up compared to adults. But the ones that don't are like, why was your brain inflamed at the time? And then every time you do that, your brain actually remembers this is where glial cell activation, and our brain will remember the trauma. And so next time I get hit, my brain automatically releases that level of glutamate. Because it's like, oh, we got to clean this up. This is going to take this much work to clean it up. And so every concussion is compounded and get stronger.
Overreacting.
Yeah, because it's a memory. It's a memory to the reaction.
Mm-hmm.
So I say also the benefit of sports, the movement, the camaraderie, the like all of that is like so beautiful. I was a basketball player. Like I am all about playing sports in teams, but less of the head impact for sports. And there's so many out there that are great, but don't require that like head.
Yeah. So
even flag football.
Yeah. Although and there's collisions in that too. And I have a colleague who he pivoted out of like dental specialty, and he made like a headband that had like a sensor, like accelerometer sensor in it. And their initial like big, they went into youth women's soccer, and it was because that kind of awareness about the heading of the ball and head injuries, and they started like using these on teams, and like the data was becoming available, and it was kind of like nobody wanted a part of it anymore because it was like, this is not good. Like this is, like sport like soccer at the time, this was a while ago, was not really viewed as maybe something that was contributing to.
Yeah, and these helmets that we do see that people are wearing are really for major contusions, meaning like there is actually like a bleed or a break, and that is protective of that kind of thing. But if you're getting a break or a bleed, you're definitely getting an internal. But there's nothing we can do to protect the internal. And you're talking about a bony structure with like claws. Have you ever seen the inside of a skull? It is bony and pokey, and then you got tofu in there, just in sitting in liquid, and it just doesn't take much. So I mean, you're asking for a miracle to avoid that type of injury.
Yeah. Okay, so obviously you're not like, there's no safe route to like football. You're gonna have head injury. You're likely to have head impacts, and like you're saying, the human body anatomically just isn't set up for that. So maybe the one things you can control though, as an athlete or a parent, would be like making sure your body's inflammatory status is in a good position. That, because you said like two different athletes, one's inflamed, one's not, and the same impact. The one that's not inflamed has a better outcome typically. Did I hear that right?
Exactly. So making sure you don't have neuroinflammation, and also that your maps are on point. And this is also statistic for what's going on now with the football players did not get concussions back then, but why are we having so many more that are actually having to leave the sport? And that goes back to the environmental inflammation and the glyphosate, and why are all these kids getting injuries now when they didn't? So even though it was dangerous before, it's not like it's more, it's just that now we have very sensitive and weak systems on top of that getting hit.
It's like the bucket analogy, right?
Yeah.
It's like other things are filling it up, and then you have an impact.
So I want to ask, like, what are like, and this may be, but what are like 3 symptoms, or however many you want to name, that people might not associate with brain inflammation, but that you're like obvious? If you see these things, you're like, that's obvious.
That's a great question, actually. One of the biggest signs of brain inflammation is irritability.
Ooh.
And they did that study on kids, actually, because the parents are like, my kid's not an irritated kid, and all of a sudden he's just like angry, and it's after a concussion.
I mean, the most paradoxical thing ever. Our kid that loves football, he's like the nicest, sweetest. I would say this every fall. He like turns into a different human being. He's not playing tackle; he's playing flag. But like, there's something about that sport that when he plays it, he's like at his peak for the year. Like those like 3-4 months. And I don't know if there's like environmental.
But he is pretty irritable.
He's very irritable.
I even notice it in myself. Like when I'm feeling off one day, I'm like, and then I really go through. If I'm really honest with myself, I'm like, okay, I haven't been lifting weights. I have, and like I can validate it. And I'm like, of course I'm more sensitive right now. I'm not doing any of the things.
Yeah.
My biggest indicator is irritability.
Yeah. Okay, so that's one. What else?
I would say that it is. There's so many differences in different people. Sure. Like everyone's like trigger. But typically, what I tell people is like, whatever your low hanging weak chain is, right? Like everyone kind of knows their thing. For me, it's POTS. For someone else, it might be they get bloated. For someone else, they might get a headache. Like whatever your weak link is, will get worse. So that could be totally different for each person.
Yeah, that makes sense. Do you think that sugar is a contributor to neuroinflammation?
Oh yeah. I mean, yeah, it's straight poison. But
There it is.
yeah, and the sad part is how quickly we get addicted from the childhood, and yeah.
Yeah. Okay, and then what about that makes me think, because I just constantly see like sugar is, or ADHD is sugar in the brain. So what do you, as far, because I feel like there's a zillion parents with kids that have either been diagnosed with ADHD or they feel like their kids have ADHD. It's like insanely common at this point, possibly overusing the diagnosis too much. But
Yeah.
from your perspective in functional neurology and chiropractic, like what are some things that you see help, and kind of like where do you see that stemming from?
Yeah, I love talking about ADHD because I do think it's so misunderstood.
Yeah.
And this goes back to the energy maps of like where you're using your energy. And a lot of these kids are misusing their energy in wasteful ways. So I talk a lot about primitive reflexes and how to like know if your body's wasting energy. This is big with ADHD. But just if someone can't even hold their own posture, like they can't even sit up straight in the chair, and we sit there and say that they're distracted or they can't focus, it's like, no, this is a physical thing. They have to go through the maps of being able to defy gravity and hold their own head up and have good eye movement. And if those things aren't working right, then you're not going to be able to focus on what you're doing. And this is why it goes in order, right? We're reflexive. We map out the reflexes, which is things like gravity, right? We rock the baby when they finally pick their head up. Then we get to gross motor, where they can actually start to control their own body weight. Then we get to fine motor, then complex motor, then complex thought. So if a kid is not able to have the complex thought or they're distracted, we have to go back to like, where are they wasting their energy then? Mm-hmm. As far as the food connection of that, all that just exacerbates the whole thing, right? So same thing with the concussion, two kids can have the same meal, mm-hmm. both eating an inflammatory meal. One kid's now not able to sit still and the other kid's okay. That goes back to the brain mapping part of it. Mm-hmm. So I actually had some slight dyslexia growing up, where I would like flip things, and I hated reading out loud. It was like, and then when I learned about all of this, I actually found out I had left brain delay, and I had cerebellar stuff going on. So once I worked on that, I actually like didn't notice the issue anymore. So it's different for each person. Yeah. Just like, a kid having tics could be connected to ADHD, but it's like, why is he having the tics? Mm-hmm. This is why it's not. I don't like even the diagnosis of ADHD. I think it should be taken away altogether. I think we're really doing a discredit to like how the brain and nervous system works by putting that as even in the conversation. Yeah, I totally agree. Because all of these things are, you're able to remap it. You're not like born with that, unless you're in that true like less than 10% of people that really are born with like a neurocognitive issue. Mm-hmm. But over 90% of these diagnoses are environmental and developmental. Mm-hmm. So that's great then. That means we can do something about it. Yeah. That means you don't have to live like this.
Yeah. I'm so glad you said that about dyslexia, because this is like another one. It's been on my radar because it feels like ADHD 0.2. Yeah, where it's like now the number of kids, we're not in public school anymore, we're at homeschool, but the number of kids that were diagnosed in my children's classes and like the 2 years that we were in public school with dyslexia, I was like, this is not possible. That it's just like all of a sudden kids are being born not able to read correctly. So like, what is going on? I'm like, is it inflammation in the brain? Is it, what, or is it like the way they're being taught? Like, what is going on? So I'm so curious to hear your perspective, or like what you have seen or thinking about this.
Yeah, they're all unique to different parts of the brain. Dyslexia is more of like that brain mapping. So I would be curious to actually ask these kids, like, quickly left, right, touch your body, like Simon says, would be really hard for them. Huh. You could see it in their body. They don't have to like even ask them to read. You could like, oh, they're coordinated. So then what we do, we work on that. Like we integrate that, and that is often missed from the lack of crawling, from the lack of cross cord, from the lack of like that. What I'm talking about, those first 3 years of life of like being on the floor, mm-hmm. is when a lot of that's integrated. Mm-hmm. And it seems simple, but it's so powerful. Yeah. And the other one is like these obvious, even when you can have a kid get a concussion and now they're showing these types of symptoms. A really big one, the biggest physical indicator of ADHD is poor posture. So is it that it's the mapping of it. If I'm wasting my energy on something happens over here and it happens in my whole body, I just pulled so much energy to a certain part of my brain without not going to the prefrontal lobes. The prefrontal lobes are the last thing that are going to get the juice. Mm-hmm. And then we blame the kid, but it's like what builds the prefrontal lobes is movement. Mm-hmm. And so it's this like comes from the bottom up and then it's top down, and each little part of the brain does a little different thing. That's why I'll give you like the generalizations, and this is very much overgeneralized and it's never this black and white, but people with more of those right brain deficiencies, more common in boys than girls because they already have an imbalance in their hemispheres. Those classic ones are tics, more of that manic, can't stop, OCD, schizophrenia, and that classic ADHD. Opposite being left brain deficiency. So these are more of your like hypersensitive, take everything personally, dyslexic, body mapping type of people. And again, it can be blended, it can be mixed. More commonly though, especially because the boys naturally are supposed to have larger right hemispheres because of that, like focus in and do something efficiently, which is why they also can recruit more motor fiber than we can and more efficiently. But especially when guys have an issue with the right brain, they're way more tipped into that scale of can't stop. So they're literally using energy all the time in a physical way, wasting it where they're not able to like focus in on what they want to focus in on.
Yeah. This is like you're describing our middle child.
Yeah.
Which makes, I mean, without having the background that you have, we just understand like if you approach him too quickly about something and he is not, you can just tell when he's like his system is not integrated is the only way I can explain it. He's flopping on the ground, throwing a fit, telling us that you're asking me to move too fast, which to me I'm like, this is like a simple thing, but it is. It's like he, at my best, I'm like, okay, we're gonna slow down. Like, what do you need to just like let's sit up, and then and like giving him the space to kind of like feel his body and like whatever, calm himself all the way down, because he can't, it's like very much a lizard brain, he goes into this like completely crazy manic, like upset, can't hear me. And certainly you see that, like sometimes we see it with school, but it's not like with school work, but it's not necessarily that. It's honestly like could be anything depending on how he's, whether he's like grounded or not,
Yeah, and you can literally see it in the way they move their body. Like you can even tell, especially if if you've ever seen like an adult neurodiverse guy where he's like super smart and like CEO level, but you ask him to dance and he's like rigid and can't do the thing because it literally doesn't have the fluidity from the right hemisphere. So you can knowing that, you can literally watch them and like, are they coordinated? Can they do this thing? And I would say this is why I'm very passionate about, I want to get into schools just as much as you want to get into football. Like, I really truly think we're reversing the amount of body movement side to academic. It needs to be flipped. These kids need to be literally working out all day long.
Yeah.
And mapping their body out. And then we can talk about the frontal lobes and their behavior and what's on their mind. And, because otherwise it's fully just reactive to the environment.
Yeah, like when days that I have our kids and like, let's say you're going to be gone for the day or whatever, my favorite thing is like, I'm going to take them to like the baseball field or something to run them for an hour. And then it's like, the day's so much better.
Yeah. That's like what we spend the majority of our time doing at home. Cause, they need it. And like a lot of the things you're talking about, like, our middle, same, like he sometimes flips letters still. And I'm like, I know you're not dyslexic. Like he reads really well, but sometimes he'll like look at something really quick and like tell me it's a 3 instead of an E or whatever. And I'm like, just look back at it again, like that's so interesting to hear that. I think you said he's like left brain deficient. Is that
well, this is also the truth with kids, is that they're naturally going through these phases where they're more focusing on one side of their brain. And this is why you've heard of like regression times. Like there's like 8 natural regression periods, which is because those are the periods where they're kind of flipping and integrating the new little area of the brain that they're focusing on now. So it's very normal for, depending on their age, to have those moments where they're like, I used to be good at that, I'm not. but also an indicator of like, okay, if he is not fully seeing visually, visual is more fine motor, right? You can sit there and go do eye movements, and some people actually, just to preface, some people actually have stuff they need to do eye visually, or have born with strabismus or born with lazy eye, and that's why.
Yeah.
But otherwise, then we need to map out the body, right? If the eyes aren't doing it, then it starts with gross motor first.
That's so interesting.
And right before that, you had said like you would love to like get into schools,
Yeah.
and so like if you could get into like the Austin school district, like what would be something? How would you, just a general description of something you would change or modify? Yeah.
I would love to like go through the age and more educating the teachers of like this is the age group where they're mostly developing this part of the brain. Like for example, 0 to about 2 to 3 is mostly right brain development. From 2 to 6 is more left brain development. That's when they get their own personality. They say no, they have more movement, they want to take risks. And then it flips, right? 6 to 8. They're constantly doing this. So I would say, and it's not that specific, right? Depends on the kid. But in general, we can look at them and say, this is what their brain's needing right now. And that alone is huge. But then also the boy-girl difference and the individuality of like, well, actually, they do need different input. And men need way more motor input at that age than women. Not that women don't, but like the impact of a man not getting it is actually more detrimental. And then also just how to structure the day. Like we should start the day with movement. We should start the day with patterning and mapping. And then at the end of the day, and when you have whatever juice you have left over, you can focus on those higher level things. There's a interesting gap happening. I'm sure you guys see with kids where you're either in the public route dealing with all the traditional stuff, or you're fully in the like Montessori free play thing. And I have a lot of parents that are like, well, that just seems really extreme. Like they're not like learning academics. But then over here, it's like, well, that's stressful and toxic in its own way. And then, so I also believe that there is a big benefit to including academics at a young age, not skipping it, because you're missing a huge window of development. So it's, I think, blending the two, where we're really focusing on what's age appropriate, what's appropriate for this individual. And these things are actually not hard to test. You can actually, they can go on YouTube and University of YouTube, right? But you can learn these reflexes, and parents can see it, and the teachers can learn how to do it. And if they're seeing that a kid's constantly doing this movement or this reflex, then they say, okay, we need to integrate that, and that's great. But they know what to do, and they can actually be bio-individual. Or if someone has something more going on, like they got strep and now they're having a flare up and they need to see someone like Jana, like just knowing what to look for and when to intervene, we could do so much preventing of all of this. Yeah.
So what are your like go-to things, your non-negotiables for like taking care of your nervous system and your brain health?
For me,
personally?
Mineral balancing now for sure. I will say weightlifting has been such a game changer. I used to be in that category of like doing all the other mobility yoga only, but actual strength training, it dramatically affects my nervous system and dysautonomia if I do ever get it. My friends and community. I do God notes and meditation, and I always tune in with myself and what my body's trying to say. And I honestly just try and practice what I preach. I live a very spacious life. I have a lot of free time. I don't do the hustle culture. I take a lot of trips. So yeah, I just try and embody it. And I of course I try to eat healthy and organic and non-processed foods. I don't do any like extreme with diet though, because I think that's also like a psychological thing too.
With mineral balancing specifically, does it require testing in order to know like what minerals you need to individually supplement or seek out? Or can you explain? Because I haven't done it. So like,
it's a hair tissue test. So you take a hair sample, you cut hair in the back, and I retest mine every 3 to 4 months. But I'm more into it. You don't have to do it that much and that extreme. But everyone's is different, and depending on their chronic stress is how depleted they are in different ways. Minerals is like the electrical conductor of the cell, right? The amount of potassium on the inside versus sodium on the outside determines the electrical potential. And when someone's in a stress state, that electrical potential gets ramped up, and then the minerals imbalance. And then that's what goes to our adrenals and our thyroid. So it's like, what's the issue? Is it the thyroid, or is it the initial stress that triggered it? And now I'm depleted. And we can only really test those markers from hair, because blood is going to be a spot check of time, and calcium, sodium, magnesium have to be maintained at a certain level in blood, otherwise we'd pass out. So blood is a snapshot picture. Hair is more of a longer, over 2 to 3 month span of like, what was my cellular vitality and what happened. You can very much see it on women that have just had babies without even a test, but how they lose their hair, right? Because they went through that extreme stressor physically. But we're all doing this on a daily basis. So it's another marker that I love to use to really know on, like, what's your electrical potential. And even when people talk about like EMF and all of those things, like, this is where we really can look at those measurements versus blood.
Yeah.
I always compare to blood, but yeah.
I've actually had the kit in my bathroom for going on 6 months. I don't know what. I just, like, every night I forget to just cut the piece of hair. So I'm going to do it. Okay. We're going to have to wrap up here soon, but before we go, I would love to hear if you have, like, just so people can get kind of a, well, one, just to understand like the power of what you do, and two, just to understand a little bit better of like kind of how you work with the clients. Like, can you think of a transformation story, like something was like really powerful where you like saw a huge improvement? Like, I don't know, someone came in with something crazy and like some simple work you did, or maybe it was a long process or whatever, but like a transformation story or something that stands out about someone you've worked with.
I mean, I have so many over the years.
Yeah, I'm sure.
I would say the most like tear-jerking level ones are the ones where like nonverbal start speaking after like a few months of doing motor sensory integration.
Oh, wow.
Mm-hmm. Those are the most like powerful, because the parents are like, I never thought that would happen. And again, just from doing like biofeedback and motor and teaching the parents what to do at home.
Wow. Cool.
And then,
is that like autistic kids or
yeah,
cool.
Because it's the spectrum of like they're putting all these kids into the same bucket of category, but there's so many different layers of what's going on really for that kid. Wait, sorry, what were we asking about before that?
Yeah, just like transformation stories, kind of like an idea of like how you work with people, or just beginning end.
There was one recently that I really loved that had full spinal tremors, and after the one session she walked away still, and she was just she had been in that state for almost a year, actually from the COVID vaccine. I don't know if you want to put that in there, I'm sorry. And I did the myofascial release, the neuro release here, and for the first time in a year she was still, and that just happened recently, so that one really. She
was having spinal tremors?
Yeah, full body. Had to quit work because she couldn't stop tremoring. And we obviously did more with deeper things, but it was just doing that release, like I was saying, like a lot of people, she went to neurology, she went everywhere, and no one physically touched her, like no one like really looked at the actual nerve. So that one was really special. I'm trying to think of other ones. Like, I just recently had this guy he's been like Asperger levels his whole life. He's a great guy. He's, super sweet, but he's just like, I can't socialize. It's really uncomfortable for me to make eye contact. I get really anxious, like pass out. He just came in to see me, and he's like, he's done the prescriptions, he's done all the things. And he's like, this is the only thing that's ever worked. Why does no one talk about this? So it's just like people like that. He's, in his 50s. He thought this is just how he's going to be. And now he's finally like, oh, I can do things to help integrate into the society that I want to be in,
Yeah. How cool.
Yeah. I mean, I could think of so many more. I'm trying to think.
And I could see like the desire to get into the school system makes sense, because you meet these adults that sometimes have struggled their whole lives with these things. Like the one, the Asperger's one, had you met that person when they were 7, the previous.
Well, and then his background goes into like a lot of stuff that happened right at 1 year old with health stuff, so it's like, when you really get to like, why did this start? It all goes back to those like foundational things.
Yeah, that's so cool. Like, I'm just so intrigued by this conversation, and like all the ways that I feel like the nervous system it's really having a moment right now. Like, I think it's getting, which is like good and bad, but
I don't know if you've, like, as we've been talking, I kept having this thing of like, I want to like talk to my friend who's got a kid who I think could benefit from like, you know, seeing someone like you, like, oh, I think I know
Oh
this
yeah, yeah.
kid's like dyslexic or has a tic or is like, it like makes sense. Like, have you, it's like, it's
Well,
hard to think
even
about approaching the other
yeah,
parent being like,
sure.
have you considered like, and then,
Well, even our own kids, like,
yeah,
I mean, I think probably anybody can benefit from this kind of work,
It should
right?
be primary care, right? It should be
Yeah.
what's taught. And my biggest issue with that is the labeling and the identity of like, now I have this identity, this is who I am, and I walk through life with this like, I'm less than, I'm a subhuman, right? Like that is so not true. And all of us have stuff we can work on. Like I said, I was very good academically, but I had dyslexia too. Like I'm not out of this category, and I had immune stuff and, you know, would pass out. Like it's not like everyone has their own unique thing, but it's, if we know what to do about it, it's empowering. You know, it's not like, I don't want to tell anyone my son has an issue, which is, you know, of course it's like, no one wants to feel like something's wrong with their kid, but it's also like, this should be the foundational, this should be the school stuff, right? Like,
yeah.
Cool. Well, thank you so much for being here. This has like been such a cool conversation. I could like all of these, especially like, I just feel like we could talk forever. So you have to come back so we can do it again. But share like anything that you're doing or where people can find you, how people can see you, anything that you want to plug.
I have my own practice, Take Root Brain and Body. I have an offer that I do called Root to Rise, which is where I do all of the cellular metabolism that I mentioned, looking at the hair tissue and blood work, and nervous system assessment. And then I kind of tell you what I think is going on and give my recommendations. And then I also do in-person body work for people at in Austin, and I'm working in Costa Rica now too, so part-time.
Cool.
There.
Oh, nice.
My favorite. And you work with like all ages, right? Is like infant to whenever?
Yep. Yeah, I would say I see a lot of women with dysautonomia, but I also see a lot of men. I would say I'm like 50% women, maybe 30% men, 20% kids.
And all in-person appointments, or do you do some of this over virtual too, right? Yeah.
Yeah, there's a lot you can do virtually as well. The physical work is where we can have profound differences in a short time, depending what's going on. Yeah.
So cool.
Yeah.
Awesome. Well, this has been such a fun conversation. Thank you for being here.
Yeah, thank you. My whole goal is to empower people to know how to do it themselves, right? Never outsourcing your power to someone else, even me.
Yeah.
Like we all have the same machinery. We can all do it ourselves.
Yeah, I totally agree.
Mm-hmm.
Cool.
Thank you.
Yeah.